Hello, welcome back. Today we'll be looking at a very important topic, which is the brachial artery. And my focus today is to teach you how to write essay if you're asked to write an essay on the brachial artery. And we'll be focusing on this question, which says write short notes on the brachial artery. Now, there's a mnemonic that can help you form an outline, and especially when you're asked to write on topic that I call the transit structures. The transit structures are structures that start from one point and move and terminate at another point. So with this mnemonic, I only carry strong books regularly, calmly. It can help you write an outline on these transit structures. Now, I is introduction, O is origin, C is cause, S is structure, P is branches, R is relations, and C is clinical correlation and conclusion. So as a way of introduction, the brachial artery is the main artery supply to the upper limb, continuing from the axillary artery at the lower border of the teres major and terminating by dividing into radial and ulnar arteries at the cubical fossa. Now, the origin of the brachial artery originates as a continuation of the axillary artery at the lower border of the teres major. The cause, it runs medially in the arm alongside the medial nerve within the neurovascular bundle. It passes anterior to the elbow in the cubical fossa where it lies medial to the bicep tendon before bifurcating. Here is a mnemonic that can help you to know the cause of the brachial artery, and this mnemonic is just a sentence which is mort at the fossa, M for medial to the humerus in the upper arm, A for it accompanied by the medial nerve, L it lies on the brachialis muscles in the lower arm, T it transverse the cubical fossa, and the fossa is that it ends in the cubical fossa where it bifurcates into the radial and ulnar artery. So with this mnemonic mort at the fossa, you can know the cause of the brachial artery. Now, this is a diagram. Anytime you're asked to write an essay on any structure in the body, it is always important to sketch a diagram and label that diagram to fetch you 3 points in your anatomy essays. Now, for the structure, it is a muscular artery supplying the anterior compartment of the arm. It is enclosed by fibrous sheet along the vein and the medial nerve. Now, these are the branches of the brachial artery, and with this mnemonic, professor says reading books make us rich can help you remember the branches of this artery. The P in professor represents the profundus brachial artery or the deep brachial artery. The S in says represents the superior ulnar collateral artery. The R in radial represents the radial collateral artery or from the profunda brachia. The B in books represents the biceps branches, the small muscular branches. The M and U in makes us represent the medial ulnar collateral artery and the inferior ulnar collateral artery. Then finally the R in which represent the radial and the ulnar arteries, which are the terminal branches of the brachial artery. Now, the relations of the brachial artery: anteriorly it is covered by skin, facial and bicep brachial muscle. Posteriorly it lies on the tricep brachial and the humerus. Medially it is accompanied by the medial nerve in the upper part, and laterally we have the bicep brachial and the coracobrachialis. Finally, the last C in our mnemonic, which represents clinical correlation and conclusion. The clinical correlation that is important for brachial artery is brachial artery pulse can be palpated medial to the bicep tendon at the cubical fossa, the brachial artery pulse. Secondly, we can have ischemia and compartment syndrome when there is injury or occlusion of the e.g. maybe when there is supracondylar fracture that can lead to Volkmann ischemic contracture. Now, finally, the cannulation and blood pressure measurement. Now, conclusion: the brachial artery is a vital vessel supplying the upper limb. You don't need to cram or memorize a lot of things when you want to write about the conclusion of an essay anatomy. The best way to go about it is to know one or two important of that structure you've been asked, and if you know this important, it can form your conclusion. And when you write the conclusions in essays, it fetches you 3 marks and it boosts your score. Now, I know that this mnemonic, I only carry strong books regularly, can help you form an outline, and the mnemonic have helped you, and you're now confident in writing essay on the brachial artery. And I also know that other mnemonics in these videos have helped you. Please, if that is the case, I want you to like this video, I want you to share, I want you to subscribe, I want you to turn on the notification bell to know when I post interesting content. Thank you for watching.